Tallahassee, 1957. Governor Leroy Collins was just elected governor, and Appalachia Parkway was under construction. The local telephone company used switchboard operators, and gasoline was 28 cents per gallon. Tallahassee's population was around 100,000. New to the Big Bend was Dr. A.D. Brickler, who moved here along with his family so that he could join his father-in-law, Dr. R.L. Anderson, then medical director of the Florida A&M Hospital. The Bricklers would eventually come to love Tallahassee, but first, they had to overcome a new experience: segregation.
When I came to Tallahassee, I had been here just a few weeks when I realized I disliked it terribly. I hadn't really gotten that much exposure to segregation. When we would go shopping or something like that, it was just very unpleasant.
In the South, going to a conference and you wanted to stay in the local hotel, that was not allowed. You wanted to eat in the local restaurant, that was not allowed.
I can remember a great deal of turmoil at the schools when we were integrating, and the thing was that there was insulation at home. Our parents made us feel very comfortable here, so no matter what was going on outside, we knew we were safe inside.
And it wasn't until after 65, 66 when things started opening up. And since then, I mean, now I love Tallahassee and I wouldn't want to live anyplace else.
Dr. Brickler joined the staff at Florida A&M Hospital, which brought the number of practicing physicians to 4. Undaunted by the workload, he brought his characteristic good humor and disciplined work ethic with him.
He was one of the youngest physicians on board at the time we arrived here, and he came with all of the new ideas and new procedures, and in his quiet manner made sure we all knew where he was coming from.
As the civil rights movement continued through the 60s, segregation policies began to reverse, and the momentum was now towards desegregation. This reversal had a profound effect on the hospital at FAMU.
Hospital was funded by the state and was placed at A&M because they needed a place to train their nurses, and they couldn't go to the Tallahassee Memorial Hospital because of segregation, so that all the training, nurse training, was done at the A&M Hospital. As time passed and as the civil rights movement moved on and segregation began to fall by the wayside, the need for the hospital began to wane, and the need for it serving the nurses began to wane.
In 1971, the hospital was closed, and Doctors Anderson and Brickler became the first African American physicians to practice at Tallahassee Memorial Hospital. Desegregation was in full swing, but discrimination was still prevalent and could even be found within the hallways of TMH.
Well, and this has been told many times before, the story of where he's walking down the hall, he hears a patient calling, "Hey you, I need my room cleaned, my trash emptied," because they thought he was part of the cleaning staff, environmental services, to clean the room when he was actually a physician on staff, and he calmly did what the patient asked and didn't ask questions or make a stink of it.
He had patients who came to him from all walks of life. There were patients who came into the office with Confederate flags on their truck or tattooed on their pregnant bellies, and he gave them the same level of care that he would give anybody else.
Dr. Brickler is a saint of a man. He really is. When I am ever around him, and I've told him this, I feel like when I'm in the presence of Dr. Brickler, I'm in the presence of greatness. He has just the best disposition ever. His focus is always on the right thing, and he never wavers from that. He is a person who always seems to understand the big picture and understands the steady process on how to arrive at a destination.
In 1982, Dr. A.D. Brickler received national acclaim when he was awarded the Family Doctor of the Year by the American Academy of Family Practitioners and Good Housekeeping magazine. And no wonder. It is estimated that since moving here in 1957, he has delivered more than 30,000 babies, enough to populate a town.
One of the things that is interesting is that of the children he's delivered, there's kind of a status symbol that comes with that. People talk about being a Brickler baby, and it's a badge of honor.
Dr. Brickler has touched so many lives in so many ways, a milestone that is compounded by the fact that for more than 40 years, he has influenced hundreds of young doctors through his teaching and mentoring at the Tallahassee Memorial Family Medicine Residency Program.
The way he approaches patient care, the disciplined approach, the way he deals with staff and everyone, and with life in general, is so uplifting. And so many residents over the years have claimed that he is a tremendous role model in their lives, someone they think that they think of with reverence, and that it was a special blessing to work with him. And they hope that they're carrying a seed of what he taught them in terms of how to take care of people.
I don't think he had any idea how grateful staff, nurses, and other doctors had for him. I think he was just, I'm doing what I love doing. And you knew that he loved his job. You knew that because he showed you that daily.
I think he provided care to such a broad spectrum of Tallahassee, and with such great generosity of time and spirit.
Dr. Brickler represents the very best of our profession, always giving the best to his patients, and nothing can be better than that for the physician. The object of our affection is the patient, the best for the patient, and Dr. Brickler does it so very well.
He has done that on every level, professionally, clinically, personally. He is a man of honor, he's a man of character, he's a man of excellence. They don't get any better than Dr. Brickler. And so I think for us at TMH, it really is a privilege and an honor for him to allow us to put his name on our facility, and no better place than the Women's Pavilion, since he has touched so many lives through that part of our organization.